Hi, are you a nursing student, a RN student preparing for the NCLEX, or you are just new in RN program? Hey everyone, I'm Nurse Mia and a student nurse, RN. Welcome to another study group. RN section, NurseGetsZen Med Search Prep series, where we break down through each chapter in three focus parts, so we can learn smarter, not so harder. And the plan is, whatever you studying before the class, or preparing for the NCLEX, it's good to have an overview of kind of each chapters. So it will give you a confidence and clarity. Follow me through those three parts of each chapter, which today we cover the outline. It's part 2, medical surgical RN textbook. I think each college they have great textbooks which will improve your ability to get good scores in the classroom and NCLEX. That they say guarantee, and I kind of believe that. So check out the notes from the description below. Look out for freebies, and let's get started. It's time for me to share my screen here. So this is my outline. So see you.
Chapter 13 Overview of Cancer Care Outline is a summary of a chapter. The outline includes 9 topics. 1 is introduction, 2 epidemiology, 3 pathophysiology, 4 clinical presentation, 5 oncology emergencies, 6 prevention, 7 diagnostic cancer, 8 treatment, 9 nursing management. One introduction. Cancer is a group of diseases characterized by uncontrolled cell growth. Nurses must recognize early signs, understand treatments, and manage physical and psychosocial effects. Cancer is a leading cause of death worldwide and is expected to increase over time. Most common cancers can be lung, breast, colorectal, prostate, skin, and stomach cancer. Carcinogen exposure is a major contributing factor to epidemiology. Cancer, its prevalence in United States, the second leading cause of death, higher incidence in older adults. Risk factor can be modifiable, smoking, diet, sun exposure, and non-modifiable like age, genetics, family history. And so the cancer, its incidence, it's rising due to aging population and lifestyle factors, genetic environment, and carcinogen exposure play key roles. Few examples of other risk factors like carcinogens, it's substances that promote cancer growth like tobacco, radiation, chemicals, lifestyle, diet, physical activity, alcohol, tobacco use, hormones, estrogen, testosterone, the hormonal therapy can influence cancer risk. Immune status, weakened immunity increases susceptibility. Infection disease, certain viruses like hepatitis B, C, Epstein-Barr, HPV, increases cancer risk. Medications, long-term use of immunosuppressants, chemotherapy or radiation. 3. Pathophysiology. We have carcinogenesis, involves initiation, promotion, and progressive stages. Cancer characteristic can be anaphasia, loss of apoptosis, and anchorage independence. Metastasis, spread through lymphatics, blood, or direct invasion. Types of cancer can be solid tumors like carcinomas, sarcomas, or hematologic like leukemia, lymphoma. Staging, they have T&M system, tumor size, node involvement, metastasis. Also, like in carcinogenesis, which is the process of normal cell transforming into the cancer cell. It's thus uncontrolled cell growth, loss of normal cell differentiation, metastasis, which is a spread of cancer from the primary site to distant organs. On the staging of the cancer, it's grading, like determines how abnormal the cancer cells are, like from low grade versus high grade. The type of cancers can be like the solid tumors, malignant, which originates in organs or tissue like breast, lung, prostate. The hematological malignancies, we can assess decision-making capacity, identify or surrogate the decision marker. If the patient lacks capacity, ensure full disclosure of diagnosing and prognosis, and respect the patient right to treatment. For clinical presentation, we have the key terms like the B symptoms. It's like fatigue, weight loss, fever, weight loss. So it's seen in lymphomas and it's important diagnostic clue. The site-specific signs, breast mass, bowel habits, changes, cough. So we have in clinical presentation of cancer the caution symptoms. C, it's from change in bowel and bladder habits. A, from a sore that doesn't heal. U, from unusual bleeding discharge. T, from thickening lump in the breast or elsewhere. I, indigestion or difficulty swallowing, or from obvious change in wart or mole, and from nagging cough or hoarseness. Constitutional signs: unexplained weight loss, fever, fatigue, night sweats, and the malignancies. Specific symptoms depend on the affected organs. 5. Oncological emergencies. They have a lot of examples, but I think the chapter divides in kind of 8. The first they talk about CVC syndrome, which is the superior vena cava syndrome. It's a compression of the CVC by a tumor leads to swallowing, dyspnea, and facial edema. Treatment also, they have like radiation, chemo, corticosteroids. The second oncological emergency is the malignant pericardial infusion, which is a fluid accumulation around the heart causing cardiac tamponade. It's an emergency. 3. Disseminate intravascular coagulation, DIC, widespread clotting, followed by excessive bleeding. 4. Neurologic emergencies, increased intracranial pressure, spinal cord compression. Here it's like a treatment, a surgery, steroids, radiation. 5. Metabolic emergency, it's a tumor lysis syndrome. They call it TLC. A rapid tumor breakdown causes electrolyte imbalance. It's like high potassium, high uric acid. They use as a treatment IV hydration, electrolyte correction. 6. Extravasation of chemotherapy. It's a leakage of chemotherapy drugs into surrounding tissue, causes necrosis. Here is the treatment. Stop infusion immediately. Apply antidote if available. 7. Infusion reaction, hypersensitivity, and anaphylaxis. It's a reaction to chemotherapy or biologic agents. Management can be a pre-medication, emergency treatment, epinephrine, steroids. The last one of an example of oncological emergency, it's infection emergencies, neutropenic fever. Cancer patients are at high risk of infection due to bone marrow suspension. Any fever more than 100.4 Fahrenheit requires immediate medical attention. 6. Prevention. We have primary, secondary, and tertiary. Primary is the life modification, like vaccination. Also, we have on key terms the primary. Primary, it's the life modification vaccination. Avoiding carcinogens like tobacco, sun exposure. Healthy diet, regular exercise. Vaccination is like for hepatitis B, HPV. Secondary prevention, screening test, mammogram, colonoscopy, pap smear. This is like screening for early detection. The tertiary, it's a preventing recurrence and managing complication in cancer survivors. It's symptom control, complication prevention. Seven, the diagnostic in cancer. They have a laboratory test, tumor markers, blood tests, imaging, X-ray, CT scan, MRI, PET scans. Biopsy confirms malignancy through tissue analysis. Endoscopic procedure used for direct visualization and biopsy, for example, colonoscopy. Treatment, we have about couple of them. The main one are surgery, like surgical oncology, remove tumors surgically when possible. Radiation therapy kills cancer cell with high energy rays. Antioplastic medication is the chemotherapy. Systemic treatment to kill cancer cells. We have also the stem cell bone marrow transplants used for hematological cancer like lymphoma. Brachytherapy, it's internal radiation placed directly in and near the tumor. Nine, the nursing management. It's to monitor for side effects, provide emotional support, educate, assess distress, promote quality of life, and palliative referrals. So the pain control essential for quality of life in cancer patients. Managing side effects like chemotherapy, nausea, vomiting, fatigue, neutropenia. Another side effect, radiation therapy. From radiation therapy, it's skin irritation, fatigue. Another side effect to manage from bone marrow suspension is like increased risk of infection, bleeding, anemia. Summary of key points in cancer care. Cancer incidence is rising and risk factors include genetics, lifestyle, carcinogens, and infections. 2. Pathophysiology involves uncontrolled self-growth, loss of differentiation, and metastasis. Cancer staging, TNM system, and grading determine prognosis and treatment. Early detection is crucial. Screening and primary prevention can lower mortality rates. Treatment options include surgery, chemotherapy, radiation, and bone marrow transplants. Cancer patients require ongoing nursing support for pain, nausea, fatigue, and emotional well-being. Oncologic emergencies like CVC syndrome, tumor lysis syndrome, and neutropenic fever require immediate intervention. Chemotherapy complications include bone marrow suspension, infusion reaction, and extravasation. Nurses play a vital role in patient education, symptom management, and emotional support. End-of-life care and palliative approaches are essential for terminal cancer patients. And this is the last main key points from the chapter outline. Thank you.